In today's video, I will explain you what is the real cause of high blood pressure or hypertension. So if you're new to my YouTube channel, my name is Greta and I'm an online nutritionist and a holistic health coach. If you haven't yet, subscribe to my YouTube channel for weekly health-related videos. You can have either a primary or a secondary hypertension. Secondary hypertension means that it is coming from something else. An example of a secondary hypertension would be having hypertension because of poor kidney function. If you have primary or essential hypertension, most of the times you would be told that the cause is unknown and that you have to take blood pressure lowering medication and eat less salt. Now, there's another condition called the metabolic syndrome. Let's look at the symptoms of the metabolic syndrome for a minute. Insulin resistance, excess belly fat, high blood pressure, high blood glucose, high cholesterol. Could it be that your hypertension with an unknown cause is actually a symptom of a metabolic syndrome? Do you have any of the other symptoms, a high blood glucose or prediabetes or type 2 diabetes, a high cholesterol, high triglycerides, belly fat, insulin resistance? To know if you're insulin resistant or not, you can watch my other video about 10 insulin resistant symptoms. It should appear on the top right corner right now. And also it will appear on the screen at the end of this video. Insulin resistance is a situation where you have too much insulin and your body becomes resistant to it. And then, if we look closer at the link between insulin resistance and high blood pressure, we see that insulin resistance has a side effect. It causes high blood pressure. Hypertension is caused by too much insulin and insulin resistance. If you look at all of these metabolic syndrome symptoms, they are also symptoms of insulin resistance. So it looks like we call it in many different names, but all of these conditions originate from chronically elevated insulin and insulin resistance. Now, how is elevated insulin or hyperinsulinemia related to high blood pressure? When we have elevated insulin, it causes stiffness in our arteries. In other words, it hardens arteries. Also, high insulin causes sodium retention and loss of potassium. Sodium and potassium are two minerals that work together. For example, if you have too little potassium because you don't eat enough vegetables, you will have a high sodium. To meet our daily potassium needs, we should be consuming 7 to 10 cups of vegetables a day, every single day, and most people barely consume 1 to 3 cups. It's not really an issue of too much salt. High insulin can also cause or worsen this imbalance in sodium and potassium that affects your blood pressure. Having too much insulin blocks the absorption of potassium, so you already don't have enough, and then thanks to insulin resistance, you can't absorb the potassium that you get. The conventional treatment for high blood pressure involves taking blood pressure lowering medication and reducing your salt intake. But all this is just symptoms of too much insulin and insulin resistance. Just look at this study, showing the link between high insulin and various diseases. It shows that high insulin is involved in all of these conditions: high blood pressure, heart disease, obesity, and PCOS. And if you have several of these conditions, they would all be treated separately as unrelated conditions, and you would have to take different medication for each. So you would take metformin for blood glucose control, statins for lowering cholesterol, and diuretics for blood pressure. But what if all of these conditions are caused by elevated insulin and insulin resistance? To find out, we would have to look at how different dietary interventions aimed at lowering insulin affect high blood pressure, elevated blood glucose, excess weight, and high cholesterol. Here are some findings from studies. Interventions that aim to lower insulin improve hypertension. It helps you to lose weight. It lowers your blood glucose. It lowers your cholesterol and triglycerides and turns your LDL particles into larger, harmless particles. Instead of treating these conditions separately, or should I say managing them one by one, we should focus on removing the root cause. In case of all mentioned conditions, elevated insulin is the cause. And do you need medication for lowering insulin? Well, not really. You only have to eat less frequently, meaning no snacks, maybe sometimes skipping breakfast. and reducing the amount or proportion of your diet coming from high carbohydrate foods. By high carbohydrate foods, I mean the sugary and starchy carbohydrates. Why to lower these? Because they cause elevated insulin. Also, frequent eating causes high insulin. If you want to learn more about insulin resistance and ways to lower insulin, check out my other video where I explain it in detail. It will appear in the top right corner right now. And also at the end of this video. If you found this video useful, don't forget to like it and subscribe to my YouTube channel. You can also support me on Buy Me a Coffee or Patreon. And if you need more help and support for helping you to get back control of your health, I have an online health and weight loss coaching program that you can join today, where I help you to identify the real root cause of your conditions and help to improve it using proven to work methods. There's a link to join in the description of this video. Thanks so much for watching, and I hope to see you in the next video.